Welcome to the Egg Whisperer Show, a podcast exclusively designed to create more reproductive health awareness and discuss your fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Aimee.
Well, if you know a little bit about me, I was kind of born to help people achieve their goals when it comes to pregnancy. I come from a long line of doctors. My dad's an OBGYN. My grandfather was an OBGYN. And clearly it's in my blood. So I love talking about fertility every day, no matter what day it is. Every week to me is Infertility Awareness Week. And I don't like the word infertility as one word. I think of it as you are a fertile person. You are in fertility. See what I mean? So I'm just going to spend this show talking about fertility and misconceptions. And I'm going to have you decide along with me. I already know the answers. Which ones are fact or fiction? And I can tell you I had a lot of fun putting these together. So if I tell some silly jokes that may be more funny to me than you can only imagine how much fun I had putting together tonight's script. So here we go. The first possible misconception. It's easier to get pregnant after your first delivery. Is this a fact or fiction? I call this a fertility fiction, okay? Also known as a fertility myth. And I see this perpetuated by really well-intentioned doctors. They tell their patients, look, after your delivery with baby number 1, baby number 2 is going to be easy. And I have patients come to me with a condition called secondary infertility. That's a super common condition. And so many of my patients have it. A lot of it's attributed to the age of the eggs, sometimes the quality of the sperm, and other conditions like endometriosis, fibroids of the uterus. But if you're having a hard time getting pregnant with baby number 2, ask more questions, get checked. You've heard me in my Egg Whisperer commandments or my Egg Whisperer Holy Grail. I feel like I'm talking about these things all the time, and I'm going to keep doing it until everyone knows. Here's my recommendation. After your first delivery at your postpartum checkup, ask for your AMH level to be drawn, and then talk to your doctor about the most ideal inter-pregnancy interval based on what they know about you. When you're 40 and just had your first baby, telling someone who's 40 to wait a year and a half to have their next baby, you might want to start thinking about embryo freezing and see if that's something for you so you can still have the family size that you have always wanted without having to be upset or have fertility regret because no one told you about what happens as we get older when it comes to our eggs. And one day I wouldn't have to talk about these things because I might have that tool in my toolbox that I've been dreaming for. And what is it? Something we can inject into the ovaries so we can keep growing more eggs. Wouldn't that be awesome? If we didn't have to freeze our eggs, if we didn't have to do IVF, if we didn't have to put ourselves through all this stuff. But until then, I'm going to be doing the Egg Whisperer Show and talking to you guys about this stuff every single week until you're sick of me. So the next misconception, a miscarriage over age 40 means it's easier to get pregnant again and you should keep trying. I call that fiction. And here's why. It's harder to get pregnant as we get older. And when you're over 40, the chance that a pregnancy has a balanced set of chromosomes is really low. It isn't surprising when someone has a miscarriage, but it is no less heartbreaking when that happens. Doesn't matter how old you are, a desired pregnancy hurts no matter what your age or what the reason. So telling a woman, it's chromosomally abnormal, just wasn't meant to be. You really wanted that pregnancy, and I totally get it. I wanted it for you too, but it would not be fair for me to say, keep trying one more year, and hopefully it'll happen. My approach, I think you probably already know what it would be. It would be to be as aggressive as you feel comfortable being. Learn about your fertility. Talk to your doctor about what tests you can do, even if it's just one miscarriage. Don't take your youth for granted. So no matter how old you are when it comes to a miscarriage, use that pregnancy to guide you. There are tests that I ask my patients to do on each pregnancy if they miscarry. That will allow us to learn from that pregnancy without wondering, what did I do? Because honestly, no matter how smart you are, no matter how much school you went through or how much science, at the end of the day, for one little second, some of us blame ourselves for that miscarriage, and you really shouldn't. If I can give someone a piece of paper that tells them exactly why that miscarriage happened, I really want to do that. And so doing testing on pregnancy tissue, if you've had a miscarriage, that can somehow guide you and your doctor. That may somehow guide you and your doctor about what to do next. Here's the next one. Sperm doesn't matter. Yeah, it totally does matter. That's fiction. Sperm absolutely matters. There's no such thing as, oh, my partner has really low sperm counts, but they move really fast and I heard they're great and my doctor said it's nothing to worry about. That's called sperm sugarcoating. It's probably not a term you'll hear in the Webster's dictionary. I promise you. Probably something that I just say to my patients here. But sperm does matter. We talk about prenatals for the women. Men should take vitamins too. I recommend something like an antioxidant blend, vitamin D, CoQ10, fish oil, making sure you're not cooking your balls, you're avoiding smoking, drinking, marijuana. Those are like the obvious things. So please pay attention to sperm quality. Nutrition is important too. Preconception being and paying attention to your fitness and lifestyle. So important on both sides. You know that saying, it takes two to tango. Same thing when it comes to an embryo. It takes a healthy egg and healthy sperm too. Okay, here's another one. If you have one blocked tube, you can still get pregnant. That's totally true. That's a fact. Just because you have one blocked tube doesn't mean you can't get pregnant naturally. However, which side you ovulate on? It's a flip of a coin. And how do you know if you have one blocked tube or not? That's done through a procedure called a hysterosalpingogram. There are certainly other ways of documenting this, like a laparoscopy, a saline infusion sonogram, and there are a number of other procedures too. But talk to your doctor if you haven't had something like this and you've been trying for a while, or maybe you have risk factors like endometriosis or a ruptured appendix. Get your fallopian tube checked. And you hear me talk about the Tushy method. So you know what the T stands for, your tubes. When we ovulate, we don't alternate sides either. It's like a flip of a coin. And the other thing is, if you're ovulating from the block side, the open side won't pick up that egg. The chance that happens is probably 1 in a million. I wish it would happen more often and more frequently. I've seen it. In the last 10 years, I did have one patient who ovulated on the side that was absent, and the other side picked up that egg. So I know that it is possible, but to rely on that is something that is often possible. It's just not fair. So seek help. Talk about taking fertility pills to help yourself ovulate from the open side, and hopefully that will help. And if not, that's what IVF is for. And here's the next one. If you have 2 blocked tubes, you can still get pregnant. That's a fact. And the reason is you can get pregnant with IVF. That's what IVF was invented for. You don't need fallopian tubes to get pregnant inside your uterus. IVF bypasses the tube. The tube is the embryo transport system. When you take eggs out and you make an embryo in the Petri dish and place an embryo inside the uterus, the tubes have nothing to do with it. You don't need tubes to ovulate regularly. You don't need tubes to have regular periods. People often ask me, where does the egg go? What happens to it? They have these ideas about eggs being these really big things, kind of like a chicken egg, but that's not how eggs are in a human body. An egg is microscopic. Think of it as water in the sunlight. It's really hot over here, you guys. It's 90 degrees, and it's starting to get hot in here, so that's why I'm thinking about water evaporating. But when you see an egg and it doesn't get fertilized and that egg has nowhere to go, it's really not a big deal. And then when you have that egg white cervical mucus, that's not the egg coming out either. That's your body's natural response to estrogen levels as they rise during ovulation. And your period, that's not the egg either. That's just the lining coming out. So when your estrogen level goes up and your progesterone level goes up, and then they both come down after ovulation, the lining comes out. Totally natural process. So don't worry too much if you have a blocked fallopian tube. You can still get pregnant. Here's another one. Age of the sperm doesn't matter. Well, that's fiction. The age of the sperm absolutely matters. There are a lot of things that happen with older paternal age. Some of them are increased risk of conditions like schizophrenia, autism, imprinting disorders like Beckwith-Wiedemann syndrome. So these are things that we talk to our patients about. What is advanced paternal age and when does that start? Some people say as early as 35 or 40. Some people say not until 50. But here's what I do. I look at sperm quality. I actually do some testing called a sperm DNA fragmentation test. I look really closely at the sperm and I do whatever I can to make that DNA fragmentation percentage as low as possible, hopefully under 25%, through lifestyle changes, making sure all medical problems are teed up. For example, if there's an issue with diabetes, making sure the hemoglobin A1C is normal, taking supplements, avoiding processed foods. So there's certainly a strategy that we can use. But at the end of the day, talking to your doctor about what the risks are, super important. Now on to the next one. Marijuana is totally safe and not harmful to your fertility. I'm calling this one fiction. Marijuana, in my humble opinion, is not safe. It is harmful to your fertility. Studies have shown that it can bind to receptors in the lining of the uterus, and this can block implantation. Same with fallopian tubes. It might affect how the embryo is transported down a fallopian tube. And in men, not so good for sperm. It can change the hormone levels in a man, raising estrogen and lowering testosterone. And this can't be good for the sperm count. It can also affect sperm morphology. So you know that saying, everything in moderation. Certainly, having a joint here and there may not make a difference. But smoking frequently, chronic use, daily use, that's something that I worry about in my patients. And this is something that we talk about also. So if your partner is going through lots of shots and ultrasounds and putting her body through so much, I would suggest other ways to deal with stress, insomnia than marijuana. Take walks, drink teas, melatonin, so many other ways of dealing with stress that marijuana can maybe be lessened or just taken out of your routine completely. Here's another misconception. If you look amazing, your egg quality is too. You know who J-Lo is, right? She looks amazing. Amazing. And she had babies, I think, over the age of 37. She had her twins, I think probably around 40. And I've had people say, if J-Lo did it at 40 and I'm 37, I have 3 more years too. I wish fertility was that easy. I wish it was skin deep. It just isn't. Looking in the mirror, taking a selfie and sending it in to me to get your fertility indicators checked. Gosh, I wish that there was a way that something like that would work. Maybe one day. But until that day, we have things like FSH, estradiol, AMH levels to guide us, an ultrasound of the ovaries, where we look at the follicle count called the antral follicle count, and we put all that information together and talk to patients about what their fertility rates are at their age. Don't get me wrong, being in great shape and being super healthy is extremely important to pregnancy health. But at the same time, if you're someone who's just not quite comfortable in your clothes, you're not at your ideal body weight, please don't wait to get seen. Don't feel like we're going to judge you for your body size. Fertility doctors, we don't care about how you look. We just want you to reach your goals and be successful wherever you're at. Here's another misconception. As long as you see a fertility doctor and do IVF, you can have a baby. I wish that I had that magical power. I wish that MD meant medical deity, that I had some sort of, I certainly think that I have a gift, right? I have the gift, the ability to treat people and use my skill to help people get pregnant, hopefully with the least amount of heartache as possible. But at the end of the day, I can't turn, let's say, an egg that has chromosome issues into an egg that doesn't. I can just work with what my patients have. For example, if I have a patient who's 39 years old, let's say, and I help them get 1 normal embryo in a batch, I say, that's awesome. I got 1 normal embryo. And that's what I was expecting. But I don't have the ability to, let's say, turn the 5 embryos into 5 that are normal. And then sometimes patients have to do multiple cycles to even get 1. And those generally are patients who are over the age of 40. If you're considering doing embryo freezing, maybe consider doing it earlier in your life. Maybe when you start to think about your family, similar to the type of planning that we do when it comes to retirement or vacation plans, as far as the research we do and the things that we consider doing. Why not apply those things to when it comes to having a family? For example, I have patients that tell me, I just traveled to overseas. And before I went, for example, to Brazil, I had a number of vaccinations. I went to the travel clinic and I got these vaccinations. If we do that due diligence when it comes to fertility, I think that might save people from a lot of heartache that may be prevented. But at the end of the day, infertility is not preventable. It is inevitable. We all run out of eggs at some point in our life. All of us. All of us. There's not a single person who can say, I'm 60 and I can have a baby with my own eggs. That's impossible. So I'm hoping through this show and some of the things that I share with you, I'm going to prevent heartache in someone who's listening and watching this. And hopefully I'll get them to start their family a little bit younger or do something a little bit differently so that they don't do treatment without proper diagnosis. Here's another misconception I often have patients worry about. So I have patients who think you need ovaries to get pregnant. So fact or fiction, you don't need ovaries to get pregnant. That's a fact. You actually don't. Women can get pregnant after menopause. And you heard me just say that infertility is inevitable because we all run out of eggs at some point. But the way you can get pregnant without having ovaries is this. If you have embryos frozen or you have eggs, either from an egg donor from when you were younger frozen, we can create embryos and mimic the ovulation cycle with hormones. These are pills. We basically have you take them in a sequence of, let's say, estrogen for 2 weeks, and then estrogen combined with progesterone for 1 week. And then we put an embryo inside your uterus. It's all very well prepared, coordinated, and there's lots of testing that we do ahead of time. But this process should not make you fear that there's some sort of emergency. And what I mean by that is I have a lot of patients who come to me over the age of 45 and even now in their early 50s. And the word is out. You don't need to have regular cycles or ovaries that are working to have a baby anymore. So the more people know this, the higher the chance that someone is going to believe in themselves as a parent and maybe do something a little bit more creative to reach their goals. This one cracks me up. And if you know a little bit about me, you know I kind of love April Fool. And so here it goes. A man can have a uterine transplant. This is actually a fact. A man can have a uterine transplant. Biologically, it is possible. And I actually did a April Fool's joke about this. And I literally had a news station calling me that day saying, Dr. Aimee is the patient out of the operating room. We want to interview him immediately. And I told her to look at the calendar, and I told her it was an April Fool's joke. But it is possible. Does society need men to have uterine transplants? Maybe not now. Maybe eventually. You heard it here. Dr. Aimee says there might be a time, I'm going to predict in maybe 20 years, that there's going to be someone that's going to sign up for a uterine transplant that was born a man. Okay, here we go with another one. IUI pregnancy rates are 50% or better. So if you don't know what an IUI is, it stands for intrauterine insemination. It's basically like the turkey baster approach to fertility, right? So around ovulation time, you'll produce a sperm sample, bring it into my office, and then I'll make the sperm sparkling clean. We call that a sperm or semen wash. We then take the semen that's washed, the sperm that's prepped from the semen, we put it into a catheter, into a syringe attached to a catheter, and we deliver it to the top of the uterus. You would think if we're giving the sperm that kind of a boost that the pregnancy rate would be as high as possible, but it's still lower than 50%. At best, pregnancy rates with IUI are around 15%, 1-5. So I have patients that ask me all the time, Dr. Aimee, why didn't my IUI work? And I tell them, because you're human. So this is the thing. If you're going through the IUI process, ask your doctor, how many IUIs do you think it's going to take for me to possibly be successful? And if I'm not successful, what do you think the reason is? And what do you think I should be considering next? These are the things I talk about with each cycle that doesn't work. I ask myself, actually. I say, okay, should I increase the number of eggs ovulated? So I change how I approach the IUI, perhaps consider a double IUI. Should I add something, for example, like there's a device, it's called Zymo, Z-Y-M-O-T, fertility.com is where you can look at it. Should I add that perhaps to the IUI procedure process? Lots of things to think about. Supplements the patient did take or didn't take. Maybe we should be adding things. If she's not already on CoQ10, add that. So here is another one. I don't need to know embryo quality. I'm telling you guys, that is total fiction. And I'm like this close to saying another word, bull. Okay, I hear this all the time. Patients come to me from clinics all over the country and world. They share with me their IVF embryology reports, and I talk to them on the phone and I say, so what was the quality of your embryos like? And they say, oh, I don't know the quality. The clinic said that the quality doesn't matter. I would say in my humble opinion, I respectfully totally disagree with that. And quality does matter. The beauty of your embryo is related to your implantation rate. The stronger the embryo, the higher the chance it will work and turn into a healthy pregnancy. So if you haven't done it already, please request a copy of your embryology report. Ask for complete transparency and ask them, just say, be upfront. Tell me, what are the chances with the quality that I have here? Same thing with frozen eggs. Ask the doctor after you go through an egg freeze, say, what are the chances with my frozen eggs? Because no one regrets freezing more eggs. No one regrets freezing more embryos. The only thing people get mad about is if they weren't told the truth about what their chances are, and were not given an opportunity to do more when they still had eggs. You do need to know the embryo quality. Find out when it was frozen, what the quality means, what grading criteria they use, what's the pregnancy rate for each embryo you have frozen. Because if, let's say, you have 2 embryos, you want 2 kids in your family, and you went to transfer the second one the next time for the next kid, and it didn't work, and you didn't know up front that it had, let's say, a 10% chance of pregnancy, and now you're, for example, 42 years old, you're going to be really mad. Don't be mad. Get educated and ask more questions. Okay. Here's another one. I talk a lot, if you didn't notice. I talk a lot about fertility. It doesn't matter where I am. I'm in the grocery store. I'll just say, hey, did you know this? And just because I'm curious to see if people know this kind of stuff. So when I'm in the office and I'm doing my ultrasounds, I'll say to a patient, for example, when I'm maybe meeting her for the first time, and I'll say, oh, look, I see that you have a cyst from where you're ovulating from. And then the first thing someone will often say is, a cyst? Oh my gosh, does that mean cancer? And so I thought this was a really good thing to bring up, that fact or fiction, an ovarian cyst means something is wrong. That is total fiction. We make a cyst every single month when we ovulate, called a cyst of ovulation, also known as a corpus luteum cyst. The cyst grows to the point where it's about 2 to 3 centimeters or so until the egg comes out, and then the cyst typically goes away. Sometimes it doesn't go away and can take a month or 2. Sometimes you get more pain with those cysts. Sometimes women actually go to the emergency room. The kinds of cysts that stick around tend to be cysts like endometriomas. So there's a cysts that have endometriosis in them. Dermoid cysts, they can literally have teeth, hair inside of them. And then there are also cysts that can be cancer. So if there's a cyst that you're worried about, your doctor's worried about, frequent follow-up is important, maybe checking it every 6 to 8 weeks and then monitoring it. And then if it looks like it's not going away or worrisome, removing it. And then obviously talking to someone about the chance of it being endometriosis and what you would do if that were to happen, especially if you had cyst symptoms, is important. But just knowing that cysts come and go and they're normal is a good thing. Because when you go in for your baseline ultrasound for whatever you're doing, whether it's a fertility pill cycle, a fertility shot cycle, or IVF, if you didn't know that your doctor was checking for a cyst at that first scan and that sometimes they're seen, you might be scared if someone said, oh, there's a cyst there. And you're wondering, like, how did that happen? What's wrong with me? And you should just know that next cycle, it'll probably be gone. When I see a cyst at someone's baseline ultrasound, I tell them, look, it's like you're in a plane and you're about ready for takeoff. So you're just checking everything before the plane takes off. You don't want to take off and learn that you should have never started on the trip or you should have never taken off in the first place. Finding out if there's a cyst, if it's estrogen secreting, and then talking to your doctor about what their expectations are for when it's going to go away. That's really important. So you feel like you're not lost and just don't have a timeline or any of your goals set ahead of time. Here's another one. This has been trending a lot. Fact or fiction, IVF causes childhood cancer. I just shake my head all day long about these stories that I read from pretty reputable news agencies. And then the titles are very attention-grabbing. And the other day I had a patient say that they debated doing IVF because they heard it causes childhood cancer. The facts are it does not. IVF does not cause childhood cancer. There's a study recently published that actually in the discussion section says it does not increase risk of childhood cancer. There was a slight increased risk of hepatic cancer in kids born from IVF. Let me tell you what the rates are. 1 in 20,000 to 1 in 10,000. That's a 1.17 increased risk of hepatic cancer. So the studies did not show that IVF causes childhood cancer. But when you're looking at these studies online, certainly when you just see those attention-grabbing headlines, you're made to think things that aren't true. So before you worry yourself unnecessarily, please talk to your fertility doctor about any of your concerns. I like lists. I like notes. I have patients that know that about me. They come in with their list of questions, and I even ask them to email them to me ahead of time. So if there's some articles I want to send them ahead of time, I have the opportunity to do that. So be sure to ask more questions and not believe what you read online. And certainly don't believe, I call them Facebook fertility trolls. Seriously, they're out there. They're in these Facebook groups and they talk about these things and they try and discourage people from doing the fertility treatment that they want and need. So please don't listen to them. Listen to your gut and talk to your doctor. Here's another one. I hear it all the time. Okay, so we're in the embryo transfer room and the patient asks me, does eating the pineapple core increase my implantation rates? So this is one misconception that I thought I'd pull up today. Eating French fries and pineapple core increases implantation rates. And the answer is that's total fiction. If it was true, I would walk around with a pineapple stand on every single corner. I'd probably call it the egg whisperer pineapple stand. I don't know. I don't know what I would call it. But I would probably send every patient home with a pineapple and a gift card to McDonald's so they can go get French fries. But this stuff is certainly trending right now, especially McDonald's French fries. If you read the number of people that talk about it, you would think that it actually does help. People say, oh yeah, I just had my embryo transfer and I just drove to McDonald's for my French fries. Hey, look, French fries are delicious. I love them. Who doesn't love McDonald's French? I'm sure there are people that don't, but do. But at the end of the day, they do not improve implantation rates. Same with the pineapple core, unless it's dipped with rum overnight and you suck on it, because that would just be yummy. But other than that, these things are not going to improve implantation rate. But the foods that do are things that you enjoy. A Mediterranean plant-based diet, you hear me talking about this all the time. Foods that are anti-inflammatory, those kinds of things, yeah, they might help with implantation and fertility rates. But this other stuff, no. So whatever you read, again, take it with a grain of salt and talk to your doctor because they'll know best. I would say maybe about 5%, no, probably now, maybe 2% of my 2 patient visits, I get this question. Here it is. This is the misconception. Leaking fluids after sex means there is something wrong. Fact or fiction? I just gave it away. Total fiction. It's called gravity. So when semen's ejaculating into the vagina, right? You move around a little bit and it comes out. It's supposed to. Sperm, they're really small. They're microscopic, like the eggs I talked to you about. So those sperm cells, they'll just travel into the cervix. They'll go into the nooks and crannies, little caves, and they'll travel up into the uterus and then finally end up in the fallopian tube. The semen that comes out, you don't want it in the uterus. You don't want it in the fallopian tubes. You just want the sperm cells there. So there's a mechanism that's very well coordinated by that vagina and cervix to capture the sperm and keep it there inside the cervical mucus, and those sperm cells just keep shooting up. There are sexual positions that I do recommend. Here it goes. The ones that you enjoy. That's really what I recommend. There isn't one that's better than the other. So the one that you're comfortable with and you're enjoying, I can tell you that's the best one. So here we go. Orgasms are required to get pregnant. Yes, they totally are. That's really mean not to have your partner have an orgasm and you're just having the orgasm, ejaculating and walking away. That's like totally cruel. Don't do that. Don't be that guy. Don't be that girl. Don't be that person. But in all honesty, orgasms are not required. They just aren't. I have patients that say, can I stay in the room a little bit longer because I want to masturbate after my IUI? Yeah, that's totally okay. You can do that. Do I need to hear about it? Probably not. But in all seriousness, there's nothing that's TMI or too much information in my world, because this is the stuff I talk about. I talk about baby making in every possible way, and I talk about things that maybe people aren't comfortable talking about, but this is what I'm comfortable talking about. And by talking about it, we remove the stigma and make it less taboo, so that hopefully people can get around the things that they feel not so comfortable about and get to and find joy in all the things that they do. So orgasms are not required to get pregnant, but it's really mean to walk away if you've had one. Don't be that person. Okay, here we go. Fact or fiction? You can skew gender based on when you have sex. Can you? Is when you have sex relative to when you ovulate going to give you a boy or a girl? I promise you, it is not. Maybe 50% of the time. So that's fiction. I wish that there was something that you could do, because I actually don't wish. I just want people to reach their goals the way they want and if they want a boy, they get a boy. If they want a girl, but I know that at the end of the day, the only thing that matters is a healthy pregnancy, a healthy mom, healthy baby. And I know people do a lot of things like go through IVF to give themselves a chance of having a boy or a girl. And I think that's okay if that's something that you want to do. But there isn't a trick. There isn't like an acidity in the vagina or an acidity in the urine or something like that has anything to do with that outcome. So just know that doing IVF with genetic testing technology and having the ability to choose the boy or the girl, we can't create it, is basically the only way you can do that reliably. Okay, guys, thank you for watching tonight's show. It's now 100 degrees in here. I swear to God, it's so hot. But it's been super fun talking to you guys tonight. So I look forward to seeing you guys next week.
Thank you so much for listening and making the Egg Whisperer Show a part of your weekly routine. To find show notes and a full transcript for this episode, visit draimee.org and look under the blog tab. While you're there, you can find a link for the Egg Whisperer newsletter, which keeps you in the know about fertility news. You can also find Dr. Aimee and the Egg Whisperer Show on YouTube, Instagram, or Facebook. If you'd like to learn even more, Dr. Aimee offers classes at the Egg Whisperer School, eggwhispererschool.com, or you can request a consultation on draimee.org. Thank you so much for tuning in and for sharing the Egg Whisperer Show with others. Keep sparkling and have a great day.